Imagine a pill. It eases your pain, lets you move freely. Millions embrace it, a beacon of hope. Now imagine that same pill, a silent threat. It increases your risk of heart attack, stroke. This is the story of Vioxx, a story of immense promise and devastating consequences. The Vioxx recall wasn't just about a drug, it was a wake-up call. It forced us to confront uncomfortable truths about drug safety, corporate responsibility, and the delicate balance between innovation and patient well-being. This is a story that continues to resonate today, a stark reminder of the human cost when trust is broken and profits are prioritized over people. In the late 1990s, Vioxx emerged as a breakthrough in pain management. This new generation painkiller, known as a COX-2 inhibitor, promised relief from arthritis and other chronic pain conditions without the stomach ulcers common with traditional NSAIDs like aspirin. Vioxx quickly gained popularity, embraced by doctors and patients alike. It was heavily marketed, its benefits touted in medical journals and commercials. People suffering from debilitating pain found a new lease on life, their mobility restored, their days no longer consumed by discomfort. Vioxx, it seemed, was a miracle drug. However, behind the facade of relief, a sinister side of Vioxx was emerging. Reports began to surface, whispers at first, then a chorus of concern. Vioxx, it turned out, was linked to an increased risk of heart attack and stroke. Studies revealed a disturbing trend. Patients taking Vioxx were experiencing adverse cardiovascular events at an alarming rate. The very drug that promised to improve lives was putting them at risk. The evidence became too substantial to ignore, the shadow of doubt growing darker over Vioxx's once bright future. Merck's missteps, a story of denial and delay. Facing mounting evidence, Merck, the pharmaceutical giant behind Vioxx, faced a critical decision. Their response, however, was marred by what many perceived as an attempt to protect profits over patients. Instead of promptly addressing the safety concerns, Merck downplayed the risks and defended their blockbuster drug. Internal documents later revealed that Merck had been aware of the potential heart risks associated with Vioxx early on. Yet they chose to suppress this information, continuing to aggressively market the drug. This delay in action had devastating consequences, exposing millions to a potentially life-threatening medication. The aftermath: outrage, fear, and a call for justice. The eventual recall of Vioxx in 2004 sent shockwaves through the medical community and the public. Outrage and fear were palpable. People who had trusted their health to this drug felt betrayed. The very foundation of the doctor-patient relationship, built on trust and transparency, was shaken. The Vioxx scandal triggered a wave of lawsuits. Thousands of individuals and families affected by heart attacks and strokes attributed to Vioxx sought legal recourse. The courtroom became a battleground, with victims demanding accountability and Merck defending its actions. The price of deception: legal battles and lasting repercussions. The legal battles surrounding Vioxx were fierce and protracted. Ultimately, Merck agreed to a multi-billion-dollar settlement, compensating thousands of claimants. However, no amount of money could truly compensate for the lives lost and irrevocably altered. The Vioxx saga stands as a stark reminder of the profound impact of corporate decisions on individual lives. It ignited a broader conversation about drug safety, transparency, and the role of regulatory bodies. The echoes of the Vioxx recall continue to shape the pharmaceutical industry today, a sobering reminder of the human cost of prioritizing profit over patient safety.